3 people are dead from Hantavirus. 6 people are infected, and there are concerns about people coming back to the United States and back to other countries. And now the experts say that this virus might be spreading easier than anybody had thought. Should we be worried, or is this perhaps another attempt by folks who make money on this kind of thing to say, hey, there's a gigantic problem and it could be as big as COVID? I'm not quite sure what is the right answer, and I'm not going to take a position until I do have a better idea. So it's a pleasure to welcome Rayne Guest, who is founder and CEO of ArrowClean. Welcome to the program.
Well, thanks, Lars. Nice to be talking to folks in my home state of Idaho.
Well, and I'm glad to have you on because we get out to Oregon, Washington, and Idaho on the Radio Northwest Network. So tell me this. First, describe what is ArrowClean anyway?
Well, actually, we're doing business as ArrowClean these days, and we have a patented device that creates a healthcare-grade disinfectant that actually mimics the body's immune system in fighting pathogens. So this is a liquid product. It's actually, the active ingredient is called hypochlorous acid, and that's what our white blood cells produce to fight pathogens. We make it in a machine, and we install this machine in hospitals and schools and hotels and different buildings, and then they're able to generate their own products on site and use it throughout their facilities. And, you know, guess what? Throughout COVID, the people that had us, they didn't really have problems with COVID because it really kills germs effectively.
Very good. Well, I'm glad to hear about it, and I didn't know what it was. Tell me your take on what has happened with the infection of the people on the cruise ship. This cruise ship that was going to various places, but among others, the bird watchers on the ship apparently said, hey, I know where you can find a whole lot of birds. Let's go to the landfill. And I thought, well, landfills are notorious for a lot of things, rats that carry the hantavirus among them. What should we make of this whole situation? And is it likely to be a big problem or just, you know, a few people infected? And I'm sorry for that. But other than that, no big concern for the rest of us who don't spend our time at the landfill.
Well, now they're saying they don't think it came from the landfill because that strain of hantavirus, they say, isn't indigenous to that area. Yeah. So, look, this is going to be as big as the government wants to make it, right? Earlier you brought up you were kind of on the fence. Please don't
say that, because our government seems to be able to make a mountain out of just about it.
Well, to your point earlier, you know, if there's a way that they can make money, they will do it. And the reality is, they make more money off being reactive than proactive. So, logically, would you agree that if there are germs out there, pathogens that are going to infect us and make us sick with hantavirus or COVID or pneumonia or whatever it is, would it not be logical to kill those germs before they have a chance to infect us and spread?
Yes, I would absolutely. And in fact, I've had lots of discussions over the years with medical experts who said, hey, we lose 120,000 people a year in the United States to hospital or originated, diseases. And you say, well, could we kill all that? And they say, yeah, but it would take a lot more work. In some cases, not a lot more work, but you'd have to sanitize rooms and things like that. And you think, hospitals sanitize things? Have they been doing that for hundreds of years? Well, apparently not as well as they could be doing it, right?
Well, Lars, if you want to go down that rabbit hole, I'm going to follow you down it.
Okay, go ahead.
Yes. 100,000 deaths a year that are reported from these hospital-acquired infections.
So I overstated it a bit. Sorry.
No. You're understating it by far. Because hospitals get fined if they report an infection as a hospital-acquired infection.
So they just don't report it?
Yeah, correct.
That sounds like the big city's approach to crime. I know how to bring down crime. We'll just tell people we aren't having any crime and not report it. And they've been doing that lately.
Well, look at during COVID. So long as you had a sniffle, they would report it as COVID and get paid for it.
Yep.
Yeah, so it's all about manipulating the numbers. But so to your point, so over 100,000 deaths. So we'll say 100,000 to be conservative because that's their number. Now, these deaths come from mainly C. diff, CRS, and MRSA. You would think that because these are the pathogens that are causing the deaths in hospitals, it would be required that hospitals use products that kill these pathogens quickly.
Yep.
But that's not what they do. Generally, they'll use the healthcare-grade disinfectant that may kill MRSA, but it takes 10 minutes for the product to kill MRSA. And most of those products that they use have to be reapplied 3 times for them to stay wet for 10 minutes. And then only if they get a reported C. diff or CRS case do they then go back and clean with something that kills C. diff and CRS. So that's one of the benefits of the product that comes out of our device. It kills all those things in under a minute.
And it kills, am I right in imagining they don't use the more, say, a harsher chemical because they say, yeah, this other chemical would kill it, but it's also maybe a little bit more toxic or a little bit more offensive one way or another?
Well, that's part of it, but the other part of it is they're just out there chasing their tails, and I would make an argument that, you know, what we were talking about earlier, you make money off the more infections that you have. So yeah, there's a problem there. So the product that comes out of our device, again, it mimics the white blood cells, so it's hypoallergenic. In jails, the wardens even let inmates keep our product in the cell so they can use it freely. Here's something that's sad. A jail we recently went in Baton Rouge, within 30 days of putting our system in, they had a 63% decrease in fungal infections, staph infections, et cetera, right? And, I mean, those are real numbers. So in today's world, jails have better products than hospitals. And the reason is because sheriffs have to pay if they have to take an inmate to the hospital, so they don't want to do it. So they actually are using something that works. But in hospitals, they get paid if you're sick. It's a backwards system.
It really is. Rayne, I'm going to look forward to talking to you in the future. One last thing. Once a family member was in the hospital, had to stay a few extra days because of complications, and got pneumonia. And the respiratory therapist who came in, I was talking to him, and he said, hey, anybody who comes in here for more than 2 or 3 days and is in a bed for 2 or 3 days is likely to get pneumonia. I said, really? He said, yeah. He said, I see it all the time. He said, get in, get out as fast as you can. And that was one of the respiratory therapists who was working with the patient to try to get them over the pneumonia that they got because they were in the hospital. So you're preaching to the choir. I absolutely love the idea. That's Rayne Guest, the founder and CEO of ArrowClean, formerly known as R Water. Rayne, thank you very much. I appreciate the time.